Do you realize we're probably the only country in the world that ever has continued on like normal while their country was invaded? That's how dumbed down Americans have been. That's how much apathy there is. Still, until it comes to their doorstep, right? It wouldn't matter as long as they can get to work. The war can be carrying out, but as long as it doesn't affect them, right? Yeah, like I said, you can't save freedom. Let's put it that way. You can't have freedom if you don't care. So I've said for a while, and this is just a common sense thing to me, that until care returns, and yeah, you're not going to make everybody care, and many just, well, there's nothing I could do about it. I got to get to here. So that's the way it's going to be. But really, it just makes us look kind of stupid if you think about it. Most countries know when they're being invaded. And at this point, after 3 years of our borders being flooded, we have such a good propaganda media from CNN and MSNBC and all of them that because they don't highlight it to all the overeducated, they just think everything's normal. And what their attitude is, many of them, is that nothing would ever happen to our freedoms. No, freedom's been attacked since the beginning. I mean, it always has. Just because you've gotten lucky in your lifetime doesn't always mean you will be. But until there's no longer these powers that are controlling everything, like for healthcare, it really, like I'm burning out, not because of my profession, not because of the patients I take care of. They're the easy part. It's because of the politics. It's because of how unsafe they make the environment. Because I work in psych, so like it's physically unsafe. And they don't care, and there's never any repercussions, but then they will put repercussions on a damn nurse because of their failures at the top, because of the failures at American Nurses Association, because of failures of all the experts to do the right thing. The nurses pay the price because you try to manage all this and you can't, and you get overwhelmed and you cry. You do. You cry. You go in the bathroom and you cry, and you just try to get it out. Like nobody should have to live like that. And many nurses know what I mean. They may just not want to admit it. That's not how America should be. That's not an example of America. That's an example of power-hungry, borderline sociopaths that have been controlling the entire playing field and everybody in it. And that's the reason this AI move in healthcare. Look, so many people say healthcare isn't caring anymore, and I agree with them. It's not. I know nurses that are caring, so it doesn't mean there's not. It's just they spread you so thin. How can you care? You're just a slab. They remind me of traffickers in a way. They just see you as a slab of meat at work. Yeah, just do your job till we roll out our AI, and then you're gonna help that AI so that it can help take away the humans' jobs. So see, these people don't care about giving best care. They don't. If they cared, if American Nurses Association, American Medical Association, if the hospitals administrators and CEOs cared, if any of these people cared that got on board with this Hippocratic AI, then they would have said, no, what we really need to have return is care. And that starts with staffing. But they're placing money before everything. So as long as you place money before humanity, and that's the problem with the global elites too. As much as they want to talk their good game, the hospital CEOs do this. American Nurses Association does this. Magnet, take your pick, nursing unions, the Medical Profession Association. They all do this, talk that it's about patient care. This is what your experts do. But at the end of the day, what it's about for all of them is the bottom line, which is the dollar. And they will cut costs, but they'll go on TV, they'll go to Davos, they'll bring in their global AI for healthcare, and all they're doing is taking care out of health, but they don't care because it's about the money. So until the real people, not the people they choose and say, oh, this is a caring person, until they are out of the way. And the true people, I would say the people that have bucked all the nursing unions, people that have bucked American Nurses Association, the medical, yeah, I know, it's me, it's up against all of that. But until care actually returns and you have somebody leading that is coming from a place of care, and you have a government in place that is willing to place the heart first, because that's what's missing, is the heart of America, the heart. So in order for care to return in every sector, the heart has to return. So you need to have people that care and not just talk about caring. And all I see heading up at leadership levels at the top, and even, it's some of these chief nursing officers, as I've said, all I see is people that are non-caring, that just want to monitor people on video cameras, that want to claim a bunch of best practice bullshit, or the data says this, the evidence says that. Yeah, do you look around? Do you see how, I last night I worked, I would say, it was like 16 patients. Almost half of those patients, when I was doing meds, had said they were scared there. They were scared where they were at. They were scared for their safety, that they were more anxious. And my heart broke. My heart just broke, because how much can you do? You can try to do what you can do. They want to get out of there. So their whole care has been made worse, because there's not enough staff. There's too many people, because this hospital will not staff, and they will take everybody. They take people that you would put in a county forensic unit. And then they'll put those people with people that are just there for suicide and depression. So then those people are going to end up worse. And you can't manage it if you don't have enough staff. You can manage those situations, but not without enough staff. And you're never going to get staff. AI is not going to bring you staff. What will bring you staff is when all these people that have been heading up healthcare, American Nurses Association, the nursing unions, American Hospital Association, American Medical Association, the hospital CEOs and administrators, when they start being held accountable for not putting people, not making their hospitals and their units safe, I guarantee you that'll change. When you start putting truly people that care, that are coming from a place of care, that aren't coming from what experts have told them at the top, but are coming from a place of care and can truly innovate the unit, whatever your unit is, can truly make changes in it to where, yeah, you can even benefit financially, because no psych unit in this country right now has any good reputation. And that's because nobody heading it up or the hospital system cares. That's what you need. No matter how much these people tell you they care, what they will tell you always is that, well, best practice, evidence says, our data, our spreadsheets, stick all that stuff up their butts, because they forgot the basic components about care. And the fact that they all went along with the global AI or the Hippocratic AI shows that they themselves don't care. Because when you can think a machine is going to help people, tell them how to be empathetic when it doesn't even have a heart, well, that's how stupid the experts are.